In March 2020, on Friday the 13th, SummitStone leaders held an emergency meeting to discuss the reality of the intensifying COVID-19 outbreaks. That day, they made the decision to move as many employees as possible to remote work. By March 18th, SummitStone was offering virtual services to 90% of our clients. Still, many of our high acuity clients needed in-person care. That's when our frontline behavioral health care heroes broke out their capes and stepped up, without missing a beat. Immediate protocols were initiated, including masks, social distancing, intensified cleaning schedules, and hand sanitizer. Lots and lots of hand sanitizer. We didn't know what was coming, but we were prepared to meet it head-on with our clients' needs at the forefront.
I don't think everybody or anyone really knew what to expect. I mean, we couldn't with this virus. We just couldn't know what was happening.
The program was already kind of ramping up quite a bit, and then when COVID happened, we saw a huge spike in numbers.
Coming in and working during the pandemic in person also had its own challenges, just because we're learning how to navigate how do you keep people in a room together, how do you enforce masks, how do you support people if they're having anxiety about wearing masks.
Some people, don't believe in COVID, and so there's that whole kind of aspect of making sure we're still following protocol, but dealing with clients who may have a higher acuity and aren't necessarily processing the pandemic on the same level that our workers are.
Everybody was learning new things, new ways of doing the work that we do, but making sure that the clients came first and that whoever needed us, we could respond to.
I think as a whole, as a community, we were scared and people were anxious and we were isolated and we weren't getting that face-to-face contact that we used to have. So we saw a massive increase in the number of people calling us and feeling like they needed those crisis services.
We really tried to kind of meet the pandemic where it was at as we meet our clients where we're at, and what we found was that our clientele doesn't respond well to remote services. Our really high needs clients really need us to be present with them, whether that's in a group setting or an individual setting.
That's the one thing I learned about our team at SummitStone and at Sunrise is just how flexible we could become. Like you said, we would kind of change our whole protocol in the course of a day, and just learning that we could do things a different way and we could be creative and we could just all come together and find a way to solve a problem.
I think mobile crisis was a huge need and a huge benefit for people, that we can come out in a safe way, with our social distancing and our masks, but we can be there and provide that human-to-human interaction that's super, super necessary when someone is in such a level of crisis.
Overall, it was very challenging for so many of our clients just because of, it was one, a quick change, and change is not an easy thing to happen. And then two, a lot of them are, just stuck in that environment where they have to deal with these stressors, and then they're not able to release it in a healthy way.
I think we saw an increase in client acuity in ways that they lost all their coping skills. They lost the ability to go to the gym. They lost the ability to meet with family and friends. Some lost jobs, houses. What do you tell somebody who's lost everything when deep breathing exercises and grounding exercises are just not sufficient to what they're going through.
And then I know I've heard from clients saying, like, I feel like I don't know how to communicate with people anymore, or I feel like my social supports that I had before I don't have now because I haven't seen them in a year.
The anxiety and isolation became a huge factor for our clients. Depression became a big concern.
Dealing with the drug and the alcohol withdrawals and the psych behaviors, and then on top of that having some pretty serious medical conditions to deal with as well.
this population of people who have severe mental illness and substance use and are criminal injustice involved are just really high needs. And so focusing on trying to get them care in the community as they exit, or wraparound care if they're really high needs, I think that the community impact on that is massive.
The impact on our clients was significant. We've seen an increase in, of course, overdoses, an increase in withdrawal symptoms from substances.
And I noticed that a lot of their alcohol consumption, other substance use consumption had increased, and a lot of times their environments aren't safe.
Yeah, our clients, boy, they need some hands-on stuff. They need to see people and talk to people, and there's always that group or certain client that absolutely does not need to be telehealth. They need to be in person.
Yeah. I think that our services kind of operate as a safety net, and when everything was shut down, there weren't places to go for resources and support. And so people showed up to their doctor's office asking for help. And we felt really lucky that we could be here and stay safe, but still offer those services to people who were really feeling isolated or having other impacts from the pandemic.
As humans, I think we like to keep things constant, and we don't love change. And the pandemic was like, you're gonna change your work, you're gonna change your school, you're gonna change, how you do errands and how you maybe ride public transportation. It's like every single aspect of life has needed to be modified in some way.
Something I really learned to rely on was our team here, and kind of that really close knit bond that comes out of experiencing and working through a pandemic like that, and being able to say, this is our team and we're going to get these client needs met even if they're complicated or it's hard during COVID. So I think we really learned to work well as like a multidisciplinary team and figure out how I can kind of pivot on this side and someone else can come in and fill this position. And we really learned a good sense of teamwork, and that sense that we can do whatever needs to be done to get a client's needs met. We just have to be a little bit more creative about it.
Everybody really pulled together as a team and got really creative in how we communicate, how we know what the other people are doing, what our strengths are, what our weaknesses are, how can we support each other. And we received great support from management, from all of SummitStone.
And just really the strength of the people I get to supervise and manage, it just blew me away. And so we're managing some of the highest needs of the population, and we're also doing that with care and compassion and regard for each other and each other's safety and health. And so the way that they have been able to adapt and been able to do that, I'm just so proud and happy to work with them and support them in any way I can. So I think just the resilience that I've seen is something I'm going to carry for a long time.
Ever since I've started here, I've always been told, if you need anything, you can come to us. Don't ever hesitate to ask for help. So it's more like a family, really, in a sense that everybody's just so kind and compassionate, and you can tell they really want to be here, and they want me to be here too.
With things that change so frequently, I felt a lot of support from not just the direct people that I work with, but everyone throughout SummitStone. And I think that that's really what has helped a lot of people get through some tougher days, is knowing that, you're being heard by, people up above, CEOs, people you don't work with directly. So that's really something that I value in a workplace.
I think having more patience and understanding that this is very difficult for everybody, and that it is a very unfortunate situation, but we are all in it together and we will get through it together.
They come in one way and they leave another, and it's quite astounding and amazing. We're all you know, just worth recovery and accepted, and, you know, and that we can progress and that they can get better. We can get better.
Being able to watch them transform, and it's really like a day-to-day kind of transformation that ends up happening. It's extremely rewarding. They leave here and their tool belt is way fuller, and they've started the reconnection process with their support systems, and then they're talking about getting a job, and they're going to leave to sober living. And so those things, especially because it happens in a short amount of time, it's really extraordinary, I think.
But I think we really learned some skills there of how to really understand each other and how to help clients feel a little bit more connected to other people who had similar struggles to them. And that's really powerful for people to not feel so alone or so lonely in their mental health struggles. I think we really developed a good plan there of how to help people feel more connected and heard.
I've noticed throughout the pandemic how important it is to talk about mental health, to reduce stigma of mental health. You know, I think that's one of the best things that SummitStone does. We are so good about being in the community and talking about mental health and substance use and trying to reduce the stigma.
I've noticed a lot of these patients that come in here have this feeling of being basically looked at as trash in the community. They're not respected, they're not cared about, they feel forgotten, and that's something I find very sad. So if anything, you know, this community and everybody that lives here should remember that they're human beings too, and yeah, they may have made mistakes in their lives and choices that they've made, but they're here because they want to be helped and they need that love and support.
It just kind of affirmed my commitment to serving people and knowing how important this work is.
It felt like we were doing something, I don't know, special in a way. And to be here for the clients and to get to see them in person, I think it feels like an honor.
I love to watch people recovery. You know, get their lives together and their families come together and they get jobs and get in sober living and get on the right medications and, you know, start living their life. It's very rewarding.
I got to see people recover. It's really exciting. And that's why we can keep doing what we do every day. It's not always huge moments, it's the little moments that keep you coming back. And this is SummitStone, and this is who we are. People can and do recover.